and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, my niece is pregnant and she's having trouble with some sciatic pain, so I told her we'd make a video for her and hopefully we can give her some relief. She's not even in the same state as I am, so.
Oh, really?
So
kudos for Uncle Bob.
Yeah, well, I'm trying to help her out here.
Let's see what we can do.
All right, first thing is when you have, and you're pregnant, a lot of times the pain is not sciatica. A lot of times it's just an SI problem. Your pelvis is expanding.
Sure, right.
So you have pain from that. So
SI, sacroiliac joint.
Right.
So we're talking about that joint right there. You got two of them, one there and one there.
Right.
They're kind of long joints.
It's especially if it's an SI problem, it's going to be worse with you, Maureen, when you're standing,
Sure.
weight bearing. And if that's what you're finding, at the end of this video, I'll have a link to another video we did on a brace that you can use for SI problems.
Yep.
So that's just neither here nor there. But I mean, with anybody who's having pain, isn't not necessarily sciatica. Sciatica tends to go down one leg, one side, might go down into the calf, even into the foot, and numbness and tingling and pain.
Yep.
So, all right, but we're going to assume you have sciatica. So the first thing you're going to try is you can't do extensions like we normally do on the bed.
Right.
So what I want to have you do is take a rolled sheet, and Brad, why don't you take a belt?
Sure.
And so the different ways we can do it. You can take a rolled sheet like this, and you're going to put it in your low back, kind of right below the belt line, right?
You'll kind of know. Usually it'll feel good if you're in the right spot,
Right.
and you can adjust it up and down slightly as needed.
So then with your legs kind of wide apart, and I don't want you to fall when you're doing this, but you're going to just gently kind of extend back like this. And you can even try different levels if that doesn't help. And what you're looking for is that the pain, it might get a little worse in your back, but it gets better in the leg. That's what you're definitely looking for. If it gets worse in the leg, try it a couple times. Don't just try it after one time. Oh, it's getting worse. Try it a few times and see if it starts to go out of the leg. That's a good sign.
Right.
That means it's the right thing to do.
And what about that trick, Bob, where you go and you actually kind of push towards the ceiling?
Yep, exactly. You can take your elbows at a 90-degree angle here, right angle, and you just go and bring your arms up to your chest, like this.
As you're pulling.
You're pulling, and then you bend back.
And if you're going to use a belt, do not use a shiny one because you don't want it slipping up. It's kind of nice so it grips into the cloth or your back so it doesn't slide around.
So 90-degree, I'm going up like this, I'm going back like this. And you can repeat this like 10 times. You can do this every hour if you want. That's how often you can do it.
As long as it's giving positive results.
As long as it's helping.
Right.
A lot of times what happens on this, instead of using the belt, is sometimes a countertop.
Yep.
Now, Maureen's a little bit short, but if she can find a countertop that hits her right around here on that pelvis.
Sure. So right there.
Again, right on the sacral.
You might find if you just put pressure on one spot, you could get some relief.
Sure.
Sometimes that helps people. Otherwise, it's going to be back. This is going to be in my way, but you're talking about some extension. Is that right, Bob?
Right. Exactly.
And usually it's good to get your hands back here and give it some support. If you want to use the belt at the same time with this, you can do that. And you're looking for things that are going to reduce the symptoms, and while you're doing it, you should feel it right there. Is that right, Bob?
Right, you got it. Okay, another one you can try. Again, we're just giving you ones, that's the one I would try first.
Sure.
But if that one doesn't help, I'd go ahead and give this one a shot. Go ahead and lay on your side that's not hurting. So the painful leg is on top.
Okay.
Okay, I'm laying on this side, and now you're going to experiment with how far you bring the knees up. Okay? You're going to try it first down here, and while you're in this position, I know you're pregnant, but I want you to just kind of roll your shoulder over to the, flat.
There's one little trick I'm going to show, Bob.
Okay.
I think you do this with patients too, is if you think about sliding that shoulder forward, and that helps drop the other shoulder.
The shoulder. And when it's in this position, does it relieve the pain? Does it take it away?
Yep.
We're opening up the spine here, the area where the nerves come out, and sometimes that takes the pressure off that nerve.
Right.
And you can lay here for a while, or you can even do just gentle oscillations like this.
Yep.
Just gently, oscillate back and forth. You can also bring the leg up higher and try it there.
Sure.
Sometimes people just bring one leg up like this.
Yep.
And again, do not make things worse. If things get worse, stop it right away.
It's not the right stretch.
Right.
Yep, this should clearly give relief.
Right.
Right.
And if it'd be the other way, if it was the other leg, this one, you'd do it this way. I don't want to get on my microphone. And you would go this way, bring this shoulder over to the other side.
Yep. As far as where to do this, best to do it on a carpeted floor because you probably don't have a plinth. On the bed is usually too soft.
Well, I hope she get on the floor, Brad. She's a pregnant woman.
Well, she's probably got someone around that can help her out,
All
right?
right.
But yeah, the bed, you can do the bed, but a firm bed would be better.
That's exactly right. A good firm bed. I don't think a tabletop would work. But all right, the other thing you can try. I'm less thinking that this is going to help, but it's worth a try. And this is called nerve flossing. So let's say this is the leg that's giving you trouble.
Okay.
And this is a little complicated, so you got to watch. Brad, are you going to do it from the side?
Yep, we'll give a profile.
It's nice to have, and I know Maureen's a little bit short, so she can usually, it's nice to have a chair where you can actually, I need to go here, Brad, actually.
Yep.
Where you can actually go underneath a little bit like this with the leg. So this is the painful leg. So you're going to bring the leg up and the toe up while you're bringing the head up. So toe and head go up at the same time, and then you go down, toe goes down, head goes down. And do 10 of these.
Do you round your back with that?
Yep,
Bob?
round your back, round forward. So head up, toe down, head down.
And you can see for me, this chair is a little too short. I would need a taller chair.
Oh yeah, you don't even go all the way back either, do you?
Yep.
But this flosses the nerve, and a lot of times if it's caught somewhere, it helps loosen it up.
Right.
And if there's a little inflammation, sometimes it helps calm it down.
Right. This is one that might be painful the first time, but if you do it on the second, third, and you clearly feel it getting better, then I would continue.
I don't want you pushing this again. This is not to make things worse.
Right.
If it makes things worse, you don't do it or you stop. And the other one is you don't do this a lot. This one you do maybe 10 times, twice a day at the most.
Sure.
Some people only do it once a day.
Yep.
The other ones, that back bending, you can do every hour 10 times.
Sure.
And you can do the side bending one. From the side.
The rotation.
You can do that, you can lay down a couple times a day and do that.
Right.
So
as long as they give positive results.
So Brad and I are going to show you now a position that really is a comfortable position to be in when you're having back pain, if you just want to give yourself some relief. So you want to do that, Brad?
Sure.
So again, this is going to be one, you either need to do it on the floor and you can put your foot up on a couch, or you could do it in a bed if you have some type of, I suppose you could put a footstool on the bed, right?
Sure. Yeah, if you got an ottoman, sometimes people got some nice cushy ottomans.
So
they make leg wedges for this, but most people do not have those around the house.
Yeah.
Cold pack can be helpful.
Right. We have a recipe for a cold pack. I'll link that up, Brad.
Sure.
Yeah,
you bet.
so she can make her own cold pack if you need be.
She'll like that video.
This is like a kind of a 90-90 position, and a right angle here, a right angle here, and it's a really comfortable position. I mean, generally this is going to give you relief. So if you're hurting a lot, Maureen, give this a try, and this could give you some.
Is this her first child?
No.
Oh, okay. So she got some experience.
Yep.
And I'm sure there's a lot of women out there that are thinking, what do these men know about this? They're talking.
We know about back pain, so and we know that this can be a very comfortable position.
Sure.
For no matter what. You want to show the right way to get out of bed, just rolling onto your side, Brad? I mean,
sure.
Just rolling onto your side, not onto your stomach, obviously.
And this is one where...
Because people, when they're pregnant, a lot of times, if they try to just get up like this, that makes
get scrunched up.
It makes the sciatica worse, and it's also.
I cannot speak from experience on this.
I can give you a baby right there.
There we go. All right, so we're going to go like this.
Roll onto your side like a log.
Yeah, I'm going to have to get rid of this.
Yeah, get rid of that.
Okay, then bring your legs forward and off first. This hand can go here. You're going to push with this elbow in this hand, and everything going to kind of go up together. Whew.
Yeah, and the big thing too, Maureen, throughout the day, you should try to really keep good posture. Try not to put your back in that rounded out position. Yeah. You want to grab that spine over there real quick, Brad?
Oh, yeah.
This tends to make sciatica worse. If you put your back, so this is where Brad's head would be, this is his pelvis. If you put yourself in this rounded out position, it's gonna make your sciatica worse. So
That might be hard to do if she's pretty pregnant.
I know,
so
but some
that might
people
help.
still, the more you can put it back, like a little towel or roll
Right.
towel or a pillow in your back when you sit on a couch and stuff like that too. So, all right, Maureen, I hope that helps, and have a healthy baby, and let us know when you have it. So.
And I got to tell you, this is one guy to work with. It's quite a challenge sometimes. But other than that, he's really
come
nice guy.
on, he loves me. All right.
Take care.